Dude, what is happening? So Deebo Samuels has pneumonia, and that's why he's feeling short of breath because he also has fluid on his lungs. So I showed you a picture of a normal x-ray before. This is a picture of an abnormal x-ray. You can see in that corner where that arrow is pointing to, there's blunting of the costophrenic angle, which means that there's fluid collection there. And you can also kind of see this entire lung image looks a little bit patchy. So that's what we call interstitial edema. And then it can be there in the set of pneumonia, which is an inflammatory process. And when your body's inflammation, it causes fluid to accumulate in places where it's not supposed to accumulate for. So typically the antibiotic treatment course is about 5 days, and they can stop the antibiotics after 5 days after they haven't had fevers for about 2 days, and as long as their clinical symptoms are improving. Otherwise, we need to extend the antibiotic course. Now, typically this can be treated outpatient, but stuff that we would consider bringing them into the hospital for are if they have a score of over 0 on this if they're under 65, or a score of over 1 on this if they're over 65. So confusion, abnormal lab work, increased respiratory rate, abnormal blood pressure, and then also if their oxygen levels are below 92%, that would also warrant them being brought into the hospital. So typically, if you was seen in the emergency department, they'll hit them with 1 dose of an IM medication or 1 dose of an IV medication called Rocephin, typically, but it could be something else. Strep pneumo is the most common bacteria here, but we're getting kind of scientific. I expect Deebo to be out for 1 week minimum, but probably 2 weeks while he gets his respiratory status back up as well.